So this war has now been going on for over 2 months. The death toll in Gaza, according to the local health ministry, is close to 16,000. But the WHO fears the disease could kill more people than bombs. Is that right?
Yes, it's true. And we're really running out of terms to describe this conflict. We've been using the term catastrophic for a number of weeks now. And I don't know what else we can, what other terms we can use. No, you're absolutely right. We've had close to 16,000 deaths due to violent injuries. But at the same time, we've got this increasing risk of preventable deaths due to the spread of infectious diseases and due to the failure to treat other common chronic diseases such as high blood pressure and diabetes and kidney failure and so on. The health system has been massively degraded across Gaza. From 36 functioning hospitals, we're down to 18. Most of them are just partially functioning right now. The entire southern part of Gaza now, depending on 3 hospitals that are incredibly overwhelmed. And we just cannot afford any further degradation of the health system. We can't have any more attacks on healthcare. We must assure the supply lines for fuel, water, and medicines to the health system more broadly.
And Dr. Rick, we know, according to the United Nations, that over 80% of the population in Gaza is displaced. What can you tell us about the current types and the rates of infection there right now?
Yeah, so as you rightly say now, I'm sure the viewers are familiar with the fact that many of the displaced, if not most, are now crammed into these overcrowded UNRWA schools and other collective centers. The living conditions there are just appalling. The shelter is poor. Lack of access to clean water. We're hearing, 1 to 2 liters of clean water, of drinking water available for each person per day. We're hearing of 200 people sharing one toilet. So, with toilets overflowing, open defecation, these kind of conditions are ripe for the spread of disease. And we're seeing increased numbers of respiratory infections, of diarrhea. We've had over 1,100 cases of jaundice, which would make us concerned about the spread of hepatitis, as well as terrible skin infections, scabies and head lice and so on. And the risk of major outbreaks is increasing every day. We will be very, very fortunate indeed if we don't have a major outbreak. And there are steps we can take to avoid it, but we just don't have the access, we just don't have the resources right now.
And so what are those steps and what sort of access do you need right now?
Well, the first thing is to decongest those completely overcrowded schools and collective centres. They have been designed to accept displaced people in emergencies, but they're hosting now 4 to 6 times the numbers required. So we need to decongest them. We need to be able to provide more shelters. We need to bring in appropriate levels of clean water. In an emergency, the absolute minimum, what you would expect, would be 7.5 litres of water per person per day. There are clear standards around humanitarian action. Toilets, just bringing in toilets and hand washing stations. But we would need at least, at the most, 20 people sharing a toilet. Right now, as I said, in many of these settings, it's 200 toilets 200 people using one toilet. So we know the standards, but we need the security. We need a ceasefire, frankly. I mean, we all know that. We all know what the answer is here. We cannot get on top of the problems without a ceasefire.
Dr. Rick, during the so-called pause in fighting, how much aid got in, and do you have any indication as to when the next round of trucks could gain access?
So if you look at the numbers, we've been saying all along we need 500 trucks going in per day. And during the pause, the numbers went up to around 220 from the baseline, which was around 100. So that's still well short. Over that 1 week period, we were still 2,000 trucks short of what was required. Of course, with the renewal of the offensive, no trucks went in for a couple of days. We've had more trucks go in over the last 24 to 48 hours, but it's falling well short. The Rafah crossing is insufficient to meet the needs. We need at least one other crossing, and the humanitarian action itself cannot meet the massive needs of the population. We need the commercial sector, again, revitalized. Without the commercial sector, without at least one other crossing, we will see a significant decline in the humanitarian situation, even if we have another pause.
Dr. Rick Brennan, we appreciate your time and we appreciate you, the work that you do and those at the WHO. Thanks so much.
Thank you very much. Thank you.
Well, still to come tonight, the president of COP28 is responding to critics. We'll have more on why he's defending his commitment to science.